Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of February 7th, 2022. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Cases here in Alameda County are continuing to come down, but as you can see here, they are still quite a bit higher than they have been really this entire pandemic. So certainly not a time to let our guard down, because there's still quite a bit of virus circulating in our environment, but certainly like to see it coming down as it is. And just wanted to show here that cases are coming down in all of the age groups, which is also reassuring, but interesting to note that the peak was really the highest in the youngest age groups, and the peak is lower and lower as we get to the older age groups. And this is roughly tracking with vaccination rates in each of those age groups, which I'll touch on a little more in a moment. Hospitalizations also coming in the right direction, but still rather high at 347 in the hospital, 65 of those in the ICU with COVID-19. And deaths that were recorded on the county website were at 1,643 people who've lost their lives to COVID in Alameda County. That's up 37 from when I reported last week. And as we know, deaths are continuing to accumulate, and we expect that to continue to be the case, as it is a lagging indicator that we see continue to accumulate after cases and after hospitalizations have peaked. And so by way of some updates, there was a study that was published. It was released in the MMWR, that's the Morbidity and Mortality Weekly Report that the CDC publishes, and it came out of California, and it was looking at a nice period of time there from February to December of 2021. So some of that is going to be pre-Omicron. Much of it will be pre-Omicron, but nonetheless, it was looking at using face masks of different varieties in indoor public settings, and trying to look at the difference of effectiveness with the different masks or not wearing a mask. And they were able to actually contact quite a number of people, 652 participants that were SARS-CoV-2 positive, and another 1,176 SARS-CoV-2 negative participants who were controls. They were matched controls, and all of whom self-reported having been in an indoor public setting within the 2 weeks prior to testing, and none of them had contact with anyone with confirmed or suspected SARS-CoV-2. So we're really trying to look at certain factors, and certain factors rule people out. And what they found was a couple things. One is that always using a face mask in an indoor public setting was associated with lower odds of a positive test results compared to never wearing a face mask. And then out of this group, 534 participants specified the type of face covering that they typically used, and those who used an N95 or a KN95 had a significantly lower adjusted odds of a positive test result. And you can kind of see the different masks, the risks just got lower with the increasing quality of the mask. So the reduction in risk or odds of testing positive was 83% with the N95 or KN95, 66% with a surgical, 56% with a cloth mask, and those are compared to no mask. And so I think that this is important, because we keep on hearing sort of these cries for studies to prove that masks work. It's not everything needs a randomized, double-blinded control trial. These are not pharmaceuticals. There is certainly much laboratory sort of evidence around face masks that actually filter out particles, and they're able to do quite a bit of study on these things. And this is a pretty good way of looking at it, a test negative case control design to take a look at the difference between masks. So I think this is good enough evidence if anyone needed it. I guess some people might have felt that they needed real world data on the effectiveness of masks. We don't ask for randomized double-blinded control trials for everything. We don't need ones to tell us that your chances of surviving a motorcycle crash with a helmet are much better than not. We're not going to do a randomized double-blind control trial on that. And similarly, where we are able to study within labs and with demonstrations the effectiveness. But nonetheless, I think this is reassuring in case anyone had questions about it. And now we know we can put some quantification around how much more effective one thing is than another. And this may become useful information as we get more nuanced about what we want to do in different scenarios, different settings, when case rates are high, when case rates are low, etc. By way of, and that was published in the MMWR last week, and the link is in the post. By way of another update, I wanted to talk about vaccine updates. And so first off, here in Alameda County, vaccination rates are just kind of creeping up. They're pretty high as it is. We're still at about 81.9% fully vaxxed. A little over half are vaxxed and boosted. Nice little jump within the lowest age group for vaccination rate. We were a little under 50% last time I reported. Now at 52% fully vaccinated. So good to see that we have some progress going on there. But on February 4th, the Advisory Committee on Immunization Practices, the ACIP, which is, remember, the CDC's advisory group, they voted unanimously to fully recommend the Moderna vaccine. And this is for individuals 18 and up. And so after they gained the FDA approval earlier last week, they then went to the ACIP, who then voted unanimously. And so now this makes the second COVID-19 vaccine that has the full biologic license authorization. So remember, Pfizer and Moderna both were operating under EUAs, or emergency use authorizations. In the summertime, Pfizer got theirs fully approved. They called theirs Comirnaty. And Moderna has called theirs Spikevax. Pretty sure most of us are going to keep calling them Moderna and Pfizer. But at any rate, Moderna's is called Spikevax. It is fully approved. We now have 2 fully approved SARS-CoV-2 vaccines. And so for any folks that were still holding out because they wanted to see that full approval and didn't want it to still be under emergency use, it is no longer, neither of them are any longer under emergency use authorization. And so that is positive news. In other vaccine update news, I'll touch on 0 to 5 vaccine briefly. So both Pfizer and Moderna have these vaccines in trials. Pfizer's a little bit ahead as they've been on pretty much everything so far. Remember, and I went over this in some detail in a prior briefing, but this is a much smaller dose for the 0 to 5-year-olds, and the dose, the 2-dose regimen that they were testing seemed to do well in the 6-month-olds to the 2-year-olds, but in the 2 to 5s, not so much. So they are now testing a 3rd dose. The 3rd dose will be at least 2 months after the 2nd dose. And remember, there was no safety concern here in the data that was submitted by Pfizer, but just an effectiveness concern in those 2 to 5-year-olds. And so that's the reason for adding that 3rd dose. So it appears that what is happening is that Pfizer is seeking approval for the 2-dose regimen by the end of February. The data around the 3rd dose probably won't be here until the end of March. And so it remains to be seen how this is all going to work. But it looks like they have amended their application to include this third dose for that older group, the 2 to 5s. And so hopefully we'll be hearing something soon, and we will have something available soon. Moderna has previously indicated that they would be submitting their application also in March. So we will be keeping an eye out for that. And so as we think about this next phase of COVID, and I say that because we are coming down off of this particular surge, we are hearing a lot of calls for normal this and normal that, and I think the fact of the matter is that we are still in a evolving pandemic, and we are going to continue to have to adjust. And hopefully, we use our time wisely while cases are going down. To rather than saying let's rush back to normal and then get ourselves back into a new surge, is to plan accordingly and to just keep learning and keep adjusting accordingly. So I think the first thing is knowing the risk that we're in, and what metrics are we going to look at. I think that we're kind of waiting in some ways for a little bit of the dust to settle to understand what tools we have available and what kind of recalibration we need. And what I mean by that is we have a lot of home tests now. We need to see how well our PCR testing data is being collected and reported, and how indicative it is of the situation that we're in, given that so many people we know will be or already are testing at home. So will we still look at case rates? Will we look at hospital capacity? Will we look at something else? I'll talk a little bit about one potential thing we can be looking at in a moment. But I think these are things that we all need to be asking ourselves, because Omicron kind of changed the game a little bit. And also the vaccine has been changing things quite a bit, where really we're seeing sort of two different scenarios in terms of hospitalization and death, depending on whether one is vaccinated or unvaccinated. And so what metrics we should all be thinking about as we decide how we are going about things day to day, I think remains to be seen a little bit. And so but I do think that's something that we should be thinking about, because then we can have somewhat of a tiered system, put in interventions in place when they're needed and relax them when they are less needed. And so those are some of the issues around planning that I think we should all be taking some time to think about and look at. I think the next is understanding the benefits of the different interventions that we have available. And one of them I just reviewed, which was the masks. Knowing how effective one mask is over another. That may be something that we want to step up our masks when we know we're in times of very high virus circulation. And then maybe we'll decide to do something different when the cases are coming down. But understanding the benefits of each intervention, and just having that knowledge, I think in and of itself is really important to be armed with. Same thing with vaccinations. We are clear now that the booster really is bringing the protection up to a much more significant level than just the 2 doses. And so it may be that going forward that we consider the intervention of the vaccine a 3-dose series. I just talked about the fact that that may be what is coming out for the 2 to 5-year-olds. And remember that many of our vaccines are 3-dose series. And so this would not be anything unusual. It is just something that has had to evolve as we learn, and as this virus unfortunately continues to evolve. And hopefully in the future we will have additional interventions, like a vaccine that may cover multiple strains of SARS-CoV-2. That may be some years out. We never quite got there with the flu, although I know that scientists continue to try. So those are all things that we can sort of look forward to. But right now, understanding the interventions and the tools we have, I think is very important. And having more tools, I think, is very important. We know that we've got more treatments that are available now. Hopefully they will become more and more available as time goes on. That is certainly the expectation. But also, as I think I've mentioned here, thinking about infrastructure improvements like ventilation, using our time now to really invest in our ventilation, in windows, in HVAC, in understanding and having ways to actually assess those things, even just as an individual coming into a space. How can you know that the ventilation is good? Will there be certifications that will have like the grades that the health department gives? Will there be grades for how good the infrastructure, how good the ventilation is within a space? I think those would be very welcomed. I would certainly feel reassured knowing that there was some oversight on those kind of things, because they do make a huge difference in terms of transmission in indoor spaces. And one thing that I wanted to mention that was announced last week by the CDC is an update as it relates to what I think is a really important infrastructure improvement, and that I'm actually really encouraged to hear about, and that is wastewater sampling and wastewater surveillance. So we know that SARS-CoV-2 is shed in the feces very early on in a COVID-19 infection. So even before symptoms start, patients are shedding the virus in the feces. It's a very early sign of infection. So if you are testing wastewater for a region, or even for facilities, then it is like an early warning system that is going to be much sooner than waiting for those PCR tests, or any test for that matter, because it actually will show up in the wastewater before individuals are trying to get sick. So this can really help us act earlier, help us get a jump start on things, which would give us a huge advantage. We have not had that advantage really up until now. So this can make a big difference in our response, get us to act more quickly, and so that perhaps we could actually take actions to reduce the height of any future surges. In other parts of the world, wastewater sampling is actually used to even detect polio. And so this is used as a public health tool to trigger additional surveillance within a community, or additional interventions that need to happen within a community. And so it is definitely encouraging that we are moving towards having what is really kind of a significant piece of infrastructure for us to be able to use to make better responses. And so we know that case rates, hospitalization rates, and test positivity rates have been correlating with prevalence in the wastewater sampling. And we know this because this has been, many states and many public health departments actually since 2020 have been building up this capacity. So we've had public health departments and academic centers and utility districts and prisons and facilities working on understanding and utilizing wastewater sampling and correlating that to the clinical picture or the situation in an area or in a facility. And so this is a potentially very, very powerful tool for us. It seems like so far sequencing is not really being tracked at the level of the CDC just yet from the wastewater sampling, but in many municipalities and areas it may be. And so this is all kind of being pulled together, and what the CDC has done essentially, and what they were announcing last week on February 4th, was this new surveillance dashboard on the CDC's website. The link is in the post, and basically you can see here that there's a map, and it has the levels of SARS-CoV-2 in the wastewater in different places across the United States. They reported that 37 states had some level of surveillance going on. The website showed 212 total sites with current data, meaning within the last 15 days. But in their announcement, they reported that over 400 sites were collecting, analyzing wastewater. They were going to be adding 250 more. And the goal is that they would have most states and tribal communities represented here. And so this is, again, I think something that's very encouraging, and it feels like a big step, because we know that data has been a real challenge throughout this pandemic in the United States, with a lot of siloing in different areas kind of doing their own thing. And so at least this is a start that allows us to compare data across the states. It will also hopefully encourage others to get on board, because on the map right now there's a lot of incomplete data at the moment, but hopefully that will only just get better from here. And what else is interesting about this is that this could actually be applied to other infectious diseases. And so they would actually be able to expand this beyond SARS-CoV-2 to gather data on other pathogens, whether that be the flu or even foodborne pathogens or antibiotic resistant pathogens. So this is all very exciting information in the world of public health. The other thing is this infrastructure could be used to address even other public health crises, like, for example, detecting fentanyl in the wastewater. This can give an indication around levels of substance use or contaminated drug supply with things like fentanyl. And so there may be many applications for this. So I think this is a positive tool that is coming out and is now available, at least for our review. And I think the last part that I will talk about in terms of what we might be thinking about for this next phase really is the importance of taking care of our overall health. We have had reports as far back as 2020 about individuals deferring care, putting off visits to the doctors, putting off elective procedures, or even following up on things that were critical, like early cancer diagnoses. And we've seen updated data that is showing that in addition to the over 900,000 lives that we've lost in the United States so far to SARS-CoV-2, there is also quite a bit of what's called excess mortality, where people are dying of other things. And these are higher in the older age groups, especially with folks who had diagnoses of dementia. But really, this can affect any and everyone who is putting off or avoiding getting care. And so I think it's really important to say that we were seeing this back in 2020, and it is now 2022, and people are still putting off things that we really can't afford to put off. And so I think now is a great time to be thinking about getting on schedule with your doctor. Telehealth has been a great innovation that has really taken off during the pandemic. And if you have not had a telehealth visit with your doctor, go ahead and schedule one. Also might be a good time to go ahead and start getting on calendar for those screenings, like the mammograms and pap smears and the colonoscopies and the prostate screenings. If you've put them off for this pandemic, then it may be time. And so we need to be checking in on what are the age appropriate screenings that are needed. If you've got high blood pressure and you haven't gotten your blood pressure checked for a while, or your diabetes checked, really, really important to go ahead and do that, because we can't keep putting it off. And we may be in a little bit of a COVID roller coaster for a while longer. And so we can't just so-called wait until it's over. I think we need to think about how we make sure that other things don't end up affecting our quality of life or our longevity. Even if we're able to avoid SARS-CoV-2, we cannot avoid everything, and all of those preventative measures, our primary care, our chronic disease management, all of those things are just as important now as ever, maybe even more important, because certainly we know that the stress of the pandemic and the impact that it's had on all of our systems, on access to care, those are all very, very real things. But you can make an appointment, put it out if you want, a month or two if it's nothing urgent. When we anticipate cases will be down, they might not be, but this gives some folks comfort that if you are able to control when you're scheduling routine things, sure, do it at a time when the systems are not overwhelmed. That makes perfect sense. But if you're in that category of someone who's been putting off something that is important, maybe an early diagnosis or something that is going untreated, please take that very seriously. Reach out to your primary care physician. If you don't have one, please get one. And in the meantime, please eat a good balanced diet, get some fresh air. It is beautiful out there, some sunshine, keep your stress levels down, and get a good night's sleep. Take a multivitamin supplement, consider additional vitamin D supplementation. And thank you for joining us. We will see you next Tuesday at 10 a.m.